PCOS or Polycystic Ovarian Syndrome is a common problem which affects almost 10% of women in their reproductive age. This problem is usually genetic and could be environmental or hormonal in some. The diagnosis of PCOS is very simple. It can be easily diagnosed on an ultrasound, where the ovaries are typically enlarged. They have cysts, which are small follicles which are arranged in a circle at the periphery of the ovary, which is called as a pearl's necklace. It can also be diagnosed by doing hormonal tests such as AMH, in which the AMH is typically high. It's more than 5 and typically comes as 7, 8, 9. It can also be diagnosed using FSH and LH hormones on day 2 or day 3 of the menstrual cycle. In polycystic ovaries, a PCOS, the FSH-LH ratio is reversed. Normally, the FSH is high, but in a PCOS, the LH comes higher than the FSH. DHEAS or dehydroepiandrosterone hormone is also high in polycystic ovaries, and so are the testosterone levels. Insulin levels are also high due to insulin resistance in these patients. It can also be diagnosed just looking at the patient sometimes. A PCOS patient is typically a little stout. They have a little bit of hirsutism. That means they have hair over their face, facial hair, and hair over the body is also common. Some PCO patients are also infertile, but not necessary that all the PCOS patients have an infertility problem. Although there is no cure for PCOS, there are treatments to treat symptoms of PCOS. In fact, the best treatment for PCOS is lifestyle changes. One should go on a high protein, low carbohydrate diet. One should also exercise and try to reduce the weight if one is obese. Even if one reduces the weight by about 5 to 10% of body weight, it becomes beneficial. If one is trying for infertility, then there are treatments available where one can take tablets such as clomiphene to increase the number of eggs, because very often infertility is related to hormonal problems which lead to anovulation or dysfunctional ovulation. PCO patients are in fact very easy to treat by these simple treatments. If these treatments don't work, then one can move on to gonadotropin hormonal injections or to a treatment of IVF. If PCO patients have hirsutism, that means if they have body hair, a lot of women will have a lot of facial hair. They may have a little mustache, a little beard. Sometimes they have hairy legs. Then one needs to remove these by depilatory creams or by just waxing or by even doing laser therapy. And at the same time, drugs can be given to lessen the amount of hair.